It looks like a lot of these insurance companies are being exposed. What's up, y'all? I hope y'all having a great day. I'm going to be real short, but I can't even believe that I live in a world that is so evil, that takes so much advantage of hardworking Americans. And we're going to go ahead and get into the video and talk about the incident that happened with UnitedHealth Group. My condolences to Brian Thompson, who is the CEO, who was gunned down in New York. But let's just talk about it, because I don't want to see anybody get hurt. But I want to talk about it from this perspective. It looks like a lot of these insurance companies are being exposed. All the claims that they deny from hardworking Americans, taking advantage of the elderly that's on Medicare, it has to stop, and looks like it should be against the law to do this to people. This is not even like a free service. They're paying for this insurance, and they are being denied. It's so many people that's being denied, y'all. I want to show you all some statistics. Now, the CEO, he makes $6.2 million a year. Let me show y'all what the customer service representatives make. If you're a customer service representative with UnitedHealth Group, they make about $15 an hour. If you're bilingual, you can make up to $34,000. Care coordinators, they make between $43,000 and $61,000. UnitedHealth Group serves roughly about 51 million customers, and Forbes say that they deny more people than any other health insurance company. I was looking for the stats to see how many people they are denying, but it stated that private health insurance are not required to give out how many people they are denying. But we know it's a lot, y'all. Out of those 51 million people that they're servicing, I'm sure it's over half. That's my speculation. I'm sure it is. To be honest, I would not want to work for a health insurance company, especially if I have to deny somebody who needs medical treatment. One thing that I found really interesting is that UnitedHealthcare is now being sued and being investigated because they have these algorithms that they use to deny people. It's like a computer automatic system that go ahead and deny people of their insurance claims. And what they're banking on is that a lot of people are not going to appeal these decisions. A lot of people don't even know that they can appeal the decisions. And when they appeal people's claims, they make money. It's a lot of money in the health insurance business. They are also being investigated because their Medicare Advantage, they have been denying the elderly people that's in the nursing home. Like if they are recovering from a stroke, they won't even pay the full cost for them to receive rehabilitative treatment. And it states that UnitedHealthcare, Humana, and CVS on Aetna, I just learned that, they are profiting, you guys, from denying these elderly people. Who deny elderly people? How do you live with yourself? What kind of conscience do you have doing that? I don't think these people are human, because human beings are supposed to have a conscience. How can you do that to the elderly? Another thing that's interesting to me with UnitedHealth Group is that a lot of people are celebrating this man's death. I couldn't do that personally. This man is like a Robin Hood for the weak and the fragile people. People feel like this guy who unalive, Brian Thompson, is like a hero. And he's speaking for a lot of fragile people. A lot of people have had to watch their loved ones suffer and die because they couldn't get their claims approved. So they feel like this man is a hero. And also, they talked to this lady. I don't know if y'all ever heard of this lady. Her name is Savannah Sparks. She's an influencer on TikTok, and she has like over 1 million followers. And what she does is she helps the police and law enforcement find people who do a lot of criminal activities, especially a lot of people that do a lot of racist things. She helps them find these criminals. And law enforcement asked her if she would be willing to help with the case. And the lady said, "F no." She said no, she did not want to help in the case. She said her only concern is for the people who've been denied. Says she is only concerned about the delayed and denied victims. She's not concerned with him. So I find that very interesting, y'all. Times are changing in this world. And I feel like a lot of more insurance companies are going to be exposed. A lot of these CEOs are going to be exposed in these insurance companies because people are working hard every day. Like I said, it's not a free service. They're working hard every day and they can't even afford the premiums and the deductibles. Sometimes people have to reach $1,000 before the insurance will kick in. A lot of people are not getting preventable HealthCare screenings because they can't afford the deductibles. Breast exams, cervical exams, pap smears, those wellness screenings to check for high blood pressure, diabetes. They're not even getting this done. They're only going to the doctor when things start to happen, when the condition is chronic. Then they go. And by then it's too late. So I just want to encourage y'all to make sure you all go to you all's wellness screenings. I know the deductibles are probably high. All of us who's working, we experience those high deductibles and premiums. Also, a lot of people are stuck in jobs that they hate because the job that they hate, they have good insurance. So they stay at these jobs because they have health conditions that the insurance is paying for. And they feel like if they go somewhere else, somewhere even where their talents may be appreciated or they can flourish at, their company insurance may not be that good. So they just stay at the company that they hate because of the insurance. People that work part-time and have low income, you know they can't afford to pay their deductibles. They trying to make decisions. Should I make this decision to pay my rent? Should I pay this light bill? Should I pay my phone bill? Or should I pay this deductible to get this exam done? So people making some hard decisions while these CEOs, they living good. They living the good life. We paying our premiums because y'all know that. I know mine, it comes directly out of my paycheck. I can't decide what day I want it to come out. The company decides what day it's going to come out. So a lot of people are looking at these insurance companies very differently. To be honest, I didn't even think about it until this incident happened. I did not have any idea that people was making that much money off of claims being denied. Just being in the insurance game, I did not know people were profiting like that. Y'all look it up. When you get a chance, read on how much people profit by working at these insurance companies. I know I had a friend that she said her bonuses used to be like between $6,000 and $10,000. Meanwhile, I'm getting a little $600 bonus. But I don't work in insurance. But she stated as a customer service rep, she stated that her yearly salary was average, but that bonus check was between $6,000 and $10,000. It's a lot of things that needs to improve here in America. But these people are soulless. And it's so sad that we live in times like this, that people are not even considerate of people, abusing the elderly. My gosh, that is so sick to me. And just know that if you get denied for anything, that you can always appeal it. You can also request an external review. And you will have to look that process up, but you can request it. You can also ask them to do an internal review. So there's steps for that as well. So make sure you look that up. And what I found is that if you ask your doctor or the nurses for assistance, they will also help you and assist you in the steps to take to make sure that your medical claim is approved, because I've had that happen to me. Y'all have to excuse the lighting here. It is 3 o'clock here and it looks like it's about 6 o'clock. But I just wanted to talk to you all about that. I think what happened with UnitedHealth Group CEO is very sad that this happened to him, but it also just makes us aware of what's going on and how these companies are profiting off of us. Like we're nothing. We mean absolutely nothing. And that's so sad. Y'all put it in the comments if you all have ever had anything denied so you all can help somebody else. Put it in the comments. Let us know what you did and how you got your medical claim approved so it can help somebody else. But that's all I have, you guys. I hope you all have a great day. I hope you all be blessed and always shine bright.